this is Dr. Kate Eckert, and today we're going to talk about why it's important to do your prescribed plan of care to see if you're going to get the success that you want with the therapies in our office. So people are really used to quick fixes with steroid shots and epidurals. They want that quick relief, and they aren't accustomed to having to wait for results and wait for things. So our therapies are a little different. We do have some of those one-hit wonders. They're people that get relief right away from their treatments. We love that for them. It is super rare, but it does happen. I've seen it happen multiple times. The problem with that is that's not how the therapies we do in our office are intended to work, and that's not usually how they work. So we have this small set group of people that get total relief with one visit. The majority of people start to see results after a few visits and little results. So they'll feel a little bit of decrease in their pain after a shockwave, after a few visits, and then the pain returns. So they get a little bit of relief, a little bit of change, and then it comes back. And that relief gets longer and longer as they do their treatments. And then there's this other little subset of people that have no relief. They feel like they're just as bad. And since they're off of their anti-inflammatories, they feel even worse for a while. And they feel no difference at all until they're about a month and a half after treatment. And then they have full resolution of their pain. We have had that as many times as we've had people have one-hit wonders. We've also had the same amount of people that had zero relief. I don't feel any change. I don't feel any change. I had a ton of soreness. And then they come in week 8 and they say, I'm cured. So this isn't a one size fits all. This is not everybody gets the same trajectory of healing. There's so many factors. It's how long have you had your musculoskeletal pain. It's how much are you resting afterwards. That plays a huge role in it, not being able to rest afterwards. I try to be as upfront with people as possible, and I do have some people that will say, I really like playing pickleball. I don't want to take a break from it. I don't care if it's going to take me longer to see results. I want to still play and not give it the total rest that I should give it. And that is totally fine with me. If you want to do more visits but still play your sport, I don't mind. I just want you to be aware that getting the best results would require some rest in there. Now, for some people, it's not a sport or a hobby that keeps them from resting. It's their job. And we treat a ton of plantar fasciitis, that kind of thing. And if you have a job where you're on your feet all day, it will take longer. It's going to work, but it's going to take longer. Something we've run into are we do packages for people that are 6 weeks long, and that is the time where by 6 weeks usually we see some type of a change. If you feel zero improvement 6 weeks after you have had your first appointment, then we are not sure we're doing the right thing, and we should look into other avenues. And we do have other avenues. We have decompression, we have laser. There are other things that we can try, or we can try to refer you out somewhere that you will get relief. However, the issue we run into is if you have a lot of different spots that we can treat with shockwave, and you get excited and you want to treat all the spots all at once. What we recommend is, if you're going to do that, you commit to doing 6 weeks after that initial visit, because that truly is when some people go from seeing nothing to then having some relief. The issue is you're using all your package appointments stacked together and you only do 4 weeks or so on your amount of times, and then you're not feeling anything, so you stop care before the prescribed plan of care. And then you're missing out, because if we're finding those achy spots with shockwave, we have spots to treat, we have spots to improve. Those achy spots tell me there's a lot of good to be done in your body, and we can make a good change. So if we were not finding any achy spots and we got to 4 weeks and we weren't finding anything, it's probably not the right treatment. We're missing something. If we are still finding a ton of achy spots, you've had years and years of damage and there's a lot to be regenerated in that area and we have more work to do. That's really why we have it set up that way. And we're making the change to we're only going to focus on one area at a time. If you don't want to do multiple packages, we would just pick the most painful spot, the spot that troubles you the most, and then go from there, because it's doing yourself a disservice to not fully treat that area for the entire time. And I wouldn't consider your first visit a treatment. The first visit, we are looking to see if you're a good candidate. We're looking to see if we can find those spots. We're not making them fade all the way out. That's important in the therapy. We're just trying to see at what pad level we're finding areas and what structures they're in. So that first visit, we're not doing it exactly the same as we would on a treatment. So it would be 6 weeks after that first initial visit. And sometimes we've even had a couple people do their 6 weeks after that initial visit and then have a couple months after that, and then they feel the relief. Because cell regeneration does take 2 to 3 months, and it can be a delayed onset like that. So if you want to try shockwave in any area of your body, to totally give it a chance and focus on that, we want you to do the full 6 weeks after your initial visit to see if you have an area. The other thing is if it's a neck issue or low back issue and you have herniations, bulges, degenerative joint stuff happening, I really recommend decompression in there with that. With those issues, we are working on the soft tissue structures that are affected by irritated nerves, and we need to treat all of that because that's your symptomatic area, but we also want to get to the root cause, and that means an additional 2 appointments. So you've got the soft tissue appointment, then you would want to shockwave right to the disc area, which is a different appointment, and then you would want to open up that joint space, encourage more fluid into the disc, and that is a decompression appointment. And truly, decompression works the best if you can come in twice a week, which is more of a time commitment. So for people that have MRIs, that they know that they have disc issues, and that is a major contributing factor, what I really recommend is twice a week for at least for decompression, and then 2 shockwave appointments, addressing the soft tissue, but then also doing shockwave while you're getting decompressed to direct that shockwave more directly into the low back. We do not do it at the same time as the neck because of the way you're positioned on the table, but truly that is where we've seen the most impressive change, is combining 3 different visits in a week and doing decompression twice a week. We can try to manage your symptoms with shockwave and just the soft tissue, but it's not ideal. It's not going to get to the root cause of your issue. And there are great research articles out there where they've combined decompression with shockwave and seen regenerative changes in the disc. It's pretty amazing what it can be done, but again, it is more time consuming, more costly, but that's truly what I believe would help you better if you had disc issues like herniations, bulges, just degeneration in general. If you have any questions on these things, when you first come in, I'll give you this is what I think you should do. If you were my family member, this is what I would recommend for you. You can always try to use a less costly approach at first, but I wouldn't say that the therapies did not work for you until you try exactly what I recommend. And there is always the cost factor, and we do try to make it as cost friendly as possible. We do offer payment plans and that kind of thing, but it just all depends on what you value, how much you'd value avoiding a surgery, that kind of thing. I personally am self-employed, So to me, the value of avoiding a surgery and being able to be active in my career the value is super high. I would do almost anything to avoid a surgery because that would be really devastating to my business and that kind of thing. But everybody has different circumstances. We totally understand that, and we try to work with people the best we can. But really, my first out of the gate recommendation is what I think is going to get you the relief. That's why I make it. I try to be as personalized as I can depending on what your issue is. We try to look at imaging if you have it, those kind of things. But it's really hard to say that something did not work for you if you didn't do it exactly as it was prescribed. Let me know if you have any questions. I'd love to help with any kind of musculoskeletal injury or issue that you have.